Hello, everybody. Thank you for listening to the Healthy Project podcast. I'm your host, Corey Dion Lewis. Today, I have another great guest with me in the building. I have Brian Foster here with me. Brian, thank you so much for being on the podcast. I really appreciate it.
Sure, I'm glad to be part of it.
Yeah. So, before we get into the conversation today, can you tell the people a little bit more about yourself and kind of, what gets you up in the morning?
Sure. So, I have type 1 diabetes. I was diagnosed when I was 7, and that's pretty much my passion. We always tell people diagnosed with diabetes that it doesn't have to be your life. It's something you can manage. You can live your
Mm.
life. I just happen to make it my life. I enjoy it. I'm a diabetes educator, and I work in diabetes. So, what really gets me up in the morning is, you know, trying to help others with diabetes just do better.
No, that's cool. That's cool. And I know the last time we spoke, I know you did a lot of work with community health workers and getting them the information to really, close that gap in education with working with diabetics. So, can you tell me a little bit about your role that you played in developing some, those educational materials for those community health workers?
Sure. So, I spent a year at the American Diabetes Association, and it was fantastic. Speaking as a kid with diabetes, it was probably a dream come true to spend,
Mm.
part of my working years as part of the ADA. So it was great. I can't say more about it. The role that I had while I was there was working on a joint project between the American Diabetes Association and the American Heart Association, and it was called
Mm.
No Diabetes by Heart. And the idea is individuals with diabetes are at increased risk for cardiovascular disease. So the idea really was to bring awareness to the problem. My role specifically was creating educational programs, training programs for community health workers to enable them to work inside primary care offices to improve the care that individuals with diabetes receive.
No, that is so cool, and especially because we know that that gap between the community to healthcare is so vital, and having somebody that is one from your community, and that kind of leads to my next question, but
Sure.
someone that is from your community that understands what you're going through and kind of can translate the information for you to make you feel more comfortable when you get there is so important.
Yeah, I mean that's kind of what really makes community health workers special. Is that they have, definition of a community health worker is it's someone that has a shared experience. They typically live in that community that they reside in, and they have some connection to that community. And it could be language, it could be ethnicity, it could be chronic disease. Perhaps they have diabetes themselves, but the idea is they're linked to the community and they serve as that important need that there is between them and the healthcare providers. Um, Sorry, go
Yeah,
ahead.
and I would say, I say this a lot. When myself being a clinical health coach sometimes gets confused with community health work. But what I like to say is like, look, I may have a similar experience with somebody in the community. I may be working with someone that's African American, but if they had the opportunity, someone who is a community health worker who's African American but lives in their community, hire that guy. Right? Right? I may have on paper more education, but they know the community better
Yeah,
and they would be better served helping that individual with diabetes way more than I would.
yeah. I mean,
Sorry, go ahead.
oh no, I was going to say it comes down to trust.
Yes.
And typically, when you're from the same community or you've lived the same, or you've kind of handled the same challenges, you have a bond there. I think one of the things that works to my advantage is working in diabetes is, when I'm working with a patient, I can say I have diabetes. It doesn't mean that
Mhm.
I understand everything that they're going through, but there
Right.
is that commonality that we have between us, that kind of breaks that bond, creates that bond initially. And that's something that a community health worker has. You know, there are, how do I say it? When it comes to healthcare, you know, underserved communities have been left out. They've been
Mhm.
disenfranchised, and you can pick a million reasons why, but those in underserved communities don't have the type of healthcare that other communities do. And for that reason, they don't always have the best relationship with their doctor. And the idea of a community health worker is to really create that bond, so if their doctor doesn't have the connection, that they can help create that connection.
No, 100%. And, and that kind of you kind of answered my next question for me because we've been hearing a lot about the community health worker and the importance of community health workers. Are there any other ideas or things that you have that you feel like why community health workers are so crucial to healthcare?
Sure. I mean, because they're doing something that healthcare can't. I mean, a
Hmm.
perfect example is when a patient goes to see their doctor, and the doctor says, "I'm going to give you this medication," and the patient
Hmm.
says, "Okay." Now, there could be a million reasons why, when the patient walks out the office, that they don't start that medication. There could be a cost barrier. There could be a transportation issue. Maybe there isn't a pharmacy close by, or maybe the medication gave some kind of side effects, and they didn't feel comfortable reaching out to their doctor. But there's
Right.
some kind of breakdown between patient and provider, and that's what the community health worker does. The community health worker can sit down with the patient and say, "Are you taking this medication?" And if they say
Right.
no, they can kind of pull it out. Why aren't you? And they can take that information back to the doctor to help them make a different decision. I mean, maybe a different medication is needed, because of side effects or because of cost. Um, but the doctor doesn't know that, and that's really what the community health worker does.
Right, right. It is so interesting the stories that I hear about a patient will be the doctor will be telling the patient all these things, and the patient's like, "Yep, that's I'm doing it. Yep, I got it. Yep, all that medication you told me to take, I'm taking it." And then they'll leave and they'll tell their myself or a community health worker, "I'm not taking
I'm not
it.
taking that.
I'm not doing anything they told me."
Yeah,
Pretty much because there's not that comfort. They just want to just they don't I don't know why that is. I don't know if it's fear or if it's just because they just don't trust them that
I think
just
it's
don't trust them yet.
I mean, I can't speak for anybody,
Right.
but I mean, I think it's trust. You know what I
Yes.
mean? Individuals
Mhm.
don't trust their healthcare providers, and I mean, I have great trust in my an endocrinologist is someone who works with diabetes,
Right.
and I have a great trust in her. You think about trust, it's someone who has your back, someone you feel confident sharing things in, someone who knows that they're going to have their best interests for you. And that's something I have with my primary. You know, I went through a couple years where, I was struggling. Diabetes and depression sometimes go hand in hand.
Mm.
And, I went through several years where it was just tough to get by. Um, I reached out to my endo. I told her what was happening. She got me the help that I needed. But that never would have happened without that trust.
Right, right. Because of the stigma that is behind
Mhm.
that issue, right? So you
Yeah,
got to be able to it's so cool you had someone that you felt like you can trust. I think you bring up something that's really, really interesting too, is because when we think about trust or telling somebody, it's I would never have thought of going to my endocrinologist as the first option of who I trusted the most.
sure.
So it doesn't have to be your friend or your primary care provider that who you trust the most. It can be anybody who's within your care circle.
Sure. Absolutely. Yeah, I mean, and I think you said it right there, within the care circle. Because if you let someone know that they're within the care circle, they can let someone else know. I mean, only you have to be a certain kind of provider to be able to
Right.
prescribe medication. Nurse practitioners, PAs, doctors. But if you let someone know outside, within that circle, but not them, that individual can reach out to the provider and say they're not taking it for reasons X, Y, and Z. And can we do something else to help?
100%, 100%. One of the major issues, Brian, that I hear about with community health work services, are reimbursement and
Sure.
insurance. What are your thoughts on that challenge?
I probably can't say it on a podcast. It sucks. I mean, it's awful. It's
Right.
I mean, it's proven to work. It's something that's absolutely needed, and unfortunately, not all healthcare, but a lot of healthcare is let's treat the problem after it happens, not before it happens. You know,
Yeah.
um,
Mhm.
and this is clearly it would be a benefit. I mean, and they've done, and I say they because I haven't been involved in that aspect, but there has been good work done. Roughly about half of the states right now cover reimbursement in some way, shape, or form through Medicaid, but that leaves half of the states out.
Right.
And they're doing it piecemeal, state by state, but that's a long slog. It would be so much easier, and I know it's not the right environment, but it would be easier if this was something that was done federally.
100%. And one of the most frustrating things, and I am not a community health worker, right? That's not what I do. But I would say I do. I'm in that family. And one of the things that's kind of frustrating is having to prove your value based on if you're able to bill or not.
Right.
And I just
Absolutely.
think that is so unfair. It is
Right.
like your service isn't valuable unless you can bill.
Right. I mean, yep, I'm right there with you. I mean, I'm a clinical exercise physiologist by trade, and there's no reimbursement for that. So, yeah, I had to find something else.
Yeah.
And it's
Yeah,
not to say there,
this is an off the record conversation after this. I think.
and it's not to say that they don't have those individuals don't have value, but you're right. Without
Right.
reimbursement, they're just not part of it. And the challenge is community health workers, they don't consider them medical. You know what I mean? I mean, I think
Mhm.
they're filling a need that's just as important,
Right.
but they're not healthcare providers. I think they're health community providers. And that should be something
Mm.
different, and that should be something that's reimbursable because they are, finding out answers that our current healthcare team can't.
No, that's real. And that leads to my next question, Brian, is how do you see the role of community health workers evolving in the future when it comes to, healthcare policy and funding? What is that in your eyes, what does that look like in the future?
I think that's difficult to say. It is because there's so many, and a lot of good groups are finding success different ways. And that's part of the beauty of the idea of every state trying it
Mhm.
differently. There is something good in that, in the sense that they're trying things, they're finding out what works, what doesn't, and that's not a bad thing. It's just that there needs to be a larger swell to try and make this happen. Um,
No, that's real.
I
Mhm.
mean, I think for community health workers, they need to have like a clear scope of work. If they're going to work in a primary care office, we have to know exactly what they're going to do. They need ongoing support and supervision. Um, and it has to be part of a collaborative team environment. They have to feel like they're part of the team, and everyone in that team should know what role a community health worker does, what they can and what they can't do.
No, I agree. I agree. I want to go back to some of your work with not just with community health workers, but the work you did with educating them around diabetes and all of that.
Mhm.
You mentioned there were some educational materials for community health workers that were being developed.
Mhm.
Are these available to the
Yes.
public, and how can people access them?
Yep. Yeah. So there are two sets of materials, and they talk about quality improvement. Now quality improvement, that can be a very lengthy topic to discuss, and you can get certifications in quality improvement. But I mean, the basics can be understood by almost everybody. So the idea was, let's give community health workers another tool how they can get to work into a primary care office. So these presentations are for community health workers to teach them about quality improvement. Um, One group were stand and deliver presentations. So, someone would present to a group of community health workers. But those presentations were also done in an instructional format where if you're a community health worker, you can go on the Institute of Learning at the American Diabetes Association and take those 3 modules.
Oh, that's so cool. So they can
Yeah.
just go on there whenever they need to
Yep.
be able to
Yep.
get that information, and it's accessible for
Yep.
anybody that within that field. That's so
Yeah.
cool.
Yeah. There's, I mean, on the American Diabetes Association, there's something called the Institute of Learning, and it's free. You can sign up for it, and that gives you access to a whole lot of materials on diabetes. And
No, that's so cool.
that can be for community health workers, for diabetes educators, for all kinds of healthcare professionals.
Yeah. What advice would you give, to organizations that are looking to implement or even strengthen their community health worker program?
Hmm. Well, and I think I mentioned it earlier. Well, number one, I think they have to know what they're getting in for, what they're getting involved
Right.
in. And what I mean is, it is a commitment. Like I said, they require training, ongoing support. There needs to be continuous dialogue between community health workers and those that work there. So it's you know it's certainly not a low cost option, but I think it's a cost effective option. I think providing for community health workers and what they need to work in an office are going to bring benefits.
No, 100. Yes, no, I agree. And what do you think of the next big steps in recognizing and formalizing the work of community health workers in healthcare?
Boy, that's a tough. That's a tough question.
Yeah, I mean, in there, and especially now, a lot of this work. If we're being honest, and we're not saying anything that people who are listening right now already they're already not they're thinking about this right now is funding and what that looks like in the future. At least for right now, and we don't know what the 4 years from now is going to look like, or a couple years from now it's going to look like, but
If there is a 4 years
um
from now.
yeah. Yes. Yeah, but it's like we have the data. We know that community health workers provide a need, and you pointed that out earlier, right? And I know things are difficult, but do we pause and wait, or do we continue to try to innovate on this role, and because it is doing good work, and look for toward that next big step?
Yeah, yeah. I mean, right now they're largely funded through grants or nonprofits, but the truth is
Mhm.
that's just not a sustainable process.
Right.
There's got to be federal funds behind it to make this happen. To make this happen.
Nope, nope, that's true. So, to those future community health workers listening, if somebody is listening, they're interested in that work, um, where should they start? Like, what is a good start? Just from your experience working with them, what's a good start for somebody who wants to get into community health work?
I mean, I think there's two organizations that are going to help them, and it's a good idea just for them to go and look at it as much as they can. It's the National Association of Community Health Workers and the American Public Health Association. Both of those have different tools or different things that they can go on and learn about community health workers. The training for every state is a little bit different, but they have access. They have links to those states where you can find a little bit about what I need to do to become a community health worker.
No, that's good. That's good. Um, Brian, any last thoughts? Anything that you feel like people should know?
It's a shame because I don't think these kinds of things get talked enough about.
Hmm.
There are pieces, not necessarily part of the healthcare system, that can help with healthcare. You know, you
One
don't
hundred
have to
percent.
be you don't have to necessarily be a medical professional to bring about a medical good. And I think that's where these individuals are so very important.
You don't have to be a medical professional to bring about medical good. I love that because it is so true. And even looking at social determinants of health, it what does it say? 70% of your health outcomes come outside of the healthcare system or
Yep.
something like that. I'll look at the numbers later, but I know it's a big chunk of your healthcare is not in the not in the hospital.
Mhm. Mhm.
So to me, that only makes sense is to look outside the hospital to improve the health of our communities, especially
Yeah.
those that are in under-resourced communities or underserved communities. It just makes sense.
Yeah. Yeah.
Oh, man. Well, again, thank you so much for being on the podcast with me today. If there's anybody that's listening that wants to connect with you, learn more about what you did with the ADA, and learn more about what you're doing now, where can they reach you?
You can find me on LinkedIn. Nothing fancy about my name, Brian Foster, easy to spell. And yeah, by all means, I'd love to hear from anyone that wants to reach out.
Awesome. Again, thank you so much for being on the podcast. Everybody, thank you so much for listening to the Healthy Project podcast. Holla at you next time.